Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my intro and disclaimer before we start on our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, courses, videos to assist nurses as well as nurse practitioners with success on boards as well as in practice. Now, I always like to give the disclaimer before I get started, just as a reminder that we know there's no absolute in medicine, right? We treat on a patient by patient basis, and any of the questions that you see on my channel are based off of the current guidelines that we are tested on the ANCC as well as AANP, okay? But we know that this can vary as the test updates are done approximately every 3 to 5 years, so they don't always correlate with what we're currently doing in practice. So, with that being said, when I am teaching on anything that we may do in practice, I will always tell you one versus the other so there's no confusion, okay? All right, so let's get into question number one for today. Question number one states a mother brings in her 2-year-old son today with complaints of abdominal pain and vomiting. The nurse practitioner notes that the patient has intestinal telescoping. Based on these findings, how should the nurse practitioner diagnose? Is it A, pyloric stenosis, B, gastroenteritis, C, intussusception, or D, diverticulitis? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first to slow yourself down and ensure that you are even answering what's being asked of you, okay? So the stem of the question states, based on these findings, how should the nurse practitioner diagnose? Remembering, I always teach in the format of assessment, diagnosis, evaluation, and treatment. This is how I teach. This is how I advise you guys to study because this is how we practice. This is how we chart and this is how they test you. And so when they ask about a diagnosis, you need to run it back and see the assessment, right? So what is the assessment? What do they mean? What do we mean when we say an assessment, right? We know how to assess people. We know people are going to tell us what's going on. If there's any problem, they'll either deny having issues or explain that they have a chief complaint, right? And tell us what's going on with them. And so based off of that, that's their subjective, what they're saying to us. Then for us, we're observing as well. So as they're talking, we're asking more things in our assessment, building, our findings, but we're also observing what we see here, right? So that's your objective findings. And I know y'all know these things, but I like to kind of talk it out so you can think through when you see this on boards or even when you're doing this in practice. But here, the mother brings in her 2-year-old son. He has complaints of abdominal pain. He's been vomiting. That's the subjective. Objective, the nurse practitioner notes that, in the documents, it shows that he has intestinal telescoping, right? So, what are these key indicators of? First off, when you see intestinal telescoping, you should instantly think intussusception, okay? That is a key identifier for it. Now, the mom also is confirming this on your potential differential diagnoses because she states the abdominal pain and vomiting classic symptoms and presentation. So here, C is your best answer. Pyloric stenosis, that's where they have that narrowing and thickening of the duodenum, and they typically have that projectile vomiting, right? Gastroenteritis, you know what that is. That's more the upset stomach, diarrhea, very standard, no intestinal telescoping. They need a simple Bratz diet and, diverticulitis. They do have, they can have the constipation and the diarrhea, but they don't have intestinal telescoping, right? So you can rule those out. All right, you guys, question number two. The nurse practitioner and NP student are discussing assessments for developmental hip dysplasia. The nurse practitioner explains to have the child supine on the table and extend the hips outward. Listen for an auditory click as this is a positive finding. What test is the nurse practitioner describing? Is it A, Ortolani's test, B, Barlow's test, C, Brudinsky sign, or, or D, McMurray sign? Take a moment and tell me what you got in the comments. All right, stem of the question states, what test is the nurse practitioner describing? So let's go back and see what she explained. So they're discussing, nurse practitioner NP student are discussing developmental hip dysplasia. So the nurse practitioner is explaining, like, we're going to lie that child supine on the table and extend their hips outward. If you hear an auditory click, this is a positive finding for developmental hip dysplasia, right? So what test is that? Is that Ortolani's test? Yes, the answer is A, Ortolani's test. Remembering what the tests are already utilized for, because you can do process of elimination even if you're getting stuck on boards. Because sometimes I know all these tests run together. So you need to be able to think through these based off of what you do have, the knowledge that you do have, right? So when we're doing developmental hip dysplasia, the two common tests for that are the Ortolani's test and the Barlow's test, right? You know, Brudzinski sign is utilized as an assessment finding for meningitis. Remember, where the patient is lying supine, you bring their head up, and if it's positive, they'll bring their knees up as well. And then, you know, McMurray sign is for meniscal tears, right? So you can eliminate C and D. So now we're down to Ortolani's and Barlow's. And the way I say my Brittany's brilliance that I say to think of Ortolani's is, with Ortolani's, we bring the legs, we extend the hips outward, O for outward, O for Ortolani's. We're going to have that child lying flat, supine on their back, and you're going to take their legs. Either you can hold thighs, knees, ankles, whichever, to better, you know, get this child stabilized. And you're going to take and you're going to extend their hips outward. Okay. And you'll hear the click as the hip dislocates if there is some developmental hip dysplasia. So again, A, Ortolani is the answer. All right, and last question for today. Question number 3 states, the nurse practitioner is completing an Adams bend test on a 13-year-old female to assess for scoliosis. She notes a 9-degree curvature. Based on these findings, what is the next best step by the nurse practitioner? Is it A, have the patient follow up in 6 months for reassessment? B, refer to ortho for further evaluation and treatment? C, the patient requires further radiographic assessment? Or D, nothing at this time, this is a normal finding? Take a moment and tell me what you got in the comments. Tell me what you got. Tell me what you got. All right, you guys, stem of the question states, based on these findings, what is the next best step by the nurse practitioner? All right, so what's going on? The 13-year-old is having an Adams bend test completed to assess for scoliosis, and the nurse practitioner knows a 9-degree curvature. So you just need to know what those findings are with Adams bend test and how they are categorized, right? So would you A, have the patient follow up in 6 months for reassessment? Yes, that is the answer. Remembering, if they have a 5, anywhere from 5 to 9 degree curvature, you want to bring them back in 6 months and just reassess for any progression. You know, as the kids hit growth spurts, the curvature can increase. So you want to continue to monitor over 6-month periods to see if there's any worsening, especially with this 13-year-old being right at a 9-degree curvature already. Remembering, if it's 10 or greater, that's when they're going to require further radiographic assessment. That's a positive test for scoliosis, but you need to go do further radiographic assessment to confirm the diagnosis of scoliosis. And then you would refer to ortho for further evaluation and treatment. Okay. And then, you know, you can eliminate D because you do need to do something at this time. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. I appreciate all y'all's referrals and y'all continuing to participate. We're going to keep these daily practice questions going. I hope that they're really helping you guys with your studies, or just making you look at it a different way on how to apply the knowledge that you already have for your questions so you can be successful. Okay, that's what we're here for. But anyway, if you need us for any additional assistance, if you are preparing for boards, if you like to prepare on your own, just reviewing and getting these tips and having the videos and a few quizzes to associate by systems, there's the self-paced review course that I offer as well that you can take advantage of. We periodically do our group courses throughout the year. Just stay, I will always tell you when it is. We are currently in one of our 5 week courses. So just be on the lookout for that. And if you need a one on one session, we offer one on one sessions that you can do if there's particular weaknesses that you want to work on to make a strength. Or if you want to check your exam readiness, or if you have had an unsuccessful attempt and want to do our custom package, you know, this is designed to gauge where you are currently, see what your weaknesses are, get a customized structure plan to get you back on track, to show you where to study. Once you have had an unsuccessful attempt, you have studied, and it's not that you don't have the knowledge, and it can predominantly it comes from knowing how to apply it, or some of those other areas you really need to spend some more time on. But when you've had that unsuccessful attempt, it's hard to get back on and know what to do differently, because you felt like, hey, I did all these steps before, which way should I go now? And that's a major part of the battle. So that's what the tools that I provide for you is to slow you down and say, hey, this is where we are, this is what we find. Let's assess where you are. Let's look at your test scores and see what they said. And let's structure out something that's going to effectively allow you to convert from being unsuccessful to successful. Trust me, I've been there. So I not only teach from knowledge, but experience and what I utilize to help thousands of other MPs go from unsuccessful to successful. So if you need the assistance, we are here. Just give us a call at 803-400-6864, or shoot us an email, thenursingstudio1@gmail.com. Again, that's the nursing studio, the number one at gmail.com. And just do this, because sometimes when you're stuck and you don't know what you really need, call us so we can do a discovery call and see where you are. Or shoot us an email and we can chat and see where you are with things. Or on the website, there's a query section where you can put your contact information and type your question. So don't be nervous. Just ask, and I'm happy to let you know what I recommend. If it's something that I think you need from the nursing studio, or if I recommend that you just navigate a different way with what you currently have. So I'm here to help you guys. Just reach out. The website information, review book information is in the bio. But as always, you guys, meet me back here. Happy studying. Bye, y'all.